Hello, good afternoon, everybody. Today we are going to be talking about um, heparin. Heparin is another anticoagulant medication. Um, Today we are going to be discussing what is heparin, the action, what it does, the lab, and the teaching. And before we continue, if you have not subscribed, I want you to subscribe so anytime I upload any of this teaching, you should be able to get it. And so just go ahead and subscribe. Um, so that way, because I'll be putting a lot of stuff that you guys might need for NCLEX exams, some points. You might also need for your own just personal knowledge. All right, so let's dive into it. Today we're talking about heparin. Heparin is another anticoagulant medication. This medication is very risky. It can be given IV or it can be given subcutaneous. So when do we give this medication IV and when do we give it subcutaneous? Well, normally this medication helps to prevent or treat blood clots. So if we give this medication when the person has a blood clot already, we give it IV. And before you hang an IV, heparin IV, you must have another nurse verify it. So there has to be two nurses that have to verify the dosage of this as heparin and hang it. But the subcutaneous, some hospital make you cross-check it with another nurse, but some hospital you just give it by yourself as a nurse. So subcutaneous one, you can inject. We use it to prevent blood clots. Say, for instance, I have been to surgery. I'm not able to get up from bed. I have not been moving a lot. The doctor usually give heparin IV for you to help prevent the patient from getting blood clot. That is the reason why we give heparin IV. And when a patient is on heparin, we need to monitor his lab closely. And the labs that we're going to be monitored is called APTT. So that is the lab that that has to be monitored very closely. And another lab that we need is the platelet count, the hematocrit, and the CBC. So what are you going to be telling this patient? You're going to be careful about bleeding. You're going to be let your primary care physician or any person that is caring for you know that you are on heparin, because it is very important. Before you take any other medication, your doctor has to be aware. Say, for instance, you have an overdose of heparin. What is the antidote? The antidote for this is protamine. We have protamine sulfate. That is what we use to as antidote for this medication. So just like the one we talked about last time, which is the Coumadin. Coumadin is the oral blood thinner, while heparin is the IV or injectable blood thinner. So the heparin is also a blood thinner. So with the injectable medication or medication that goes to IV, it works fast. Right? The one that it's oral medication takes about before it starts going into the system. So most times when people come to the hospital, they stop there Coumadin if they are on Coumadin, and they start them on heparin. They start them on heparin, but before they are discharged, the patient is reversed back to his Coumadin medication that he used to take. Why do we do that? Because this one is very fast acting. This one is works so fast, and people sometimes they go home, they are not able to inject it to themselves. Sometimes they are not able to see the lines and see the quantity they are getting. I think to be on the safe side, the doctor usually put them back on their Coumadin, because the Coumadin, it's long term, it's something you can manage for at home. So this person that is on heparin, we have to closely monitor his APTT every 4 to 6 hours until the provider determine the appropriate dosage of this medication. That is why they are in the hospital. So every 4 to 6 hours, you have to go draw the blood, send it to the lab. After that, call the doctor, give it. It's usually a lot of work. Call the doctor, and then the doctor will not have to dose it. So usually when you have this patient that is on heparin, they usually give you a lesser patient because you have to monitor this. But the one thing that I want you to take home from this is what are the labs for this patient, which I said is APTT. What are the patient teaching that you have to give to this patient? Watch signs and symptoms of bleeding. Like I said, in Coumadin, if the patient is high, if the blood pressure is low, if a patient is having pain in the back, if their stool is tarry, black stool, these are signs that patient might be bleeding. So you need to be reported, you need to be checked. So if the patient is going to be having any surgery, patient teaching, that is what I just said. Patient teaching, you have to teach the patient to know what are the signs to observe. You have to teach the patient, what is this medication? Why is this medication ordered? So these are the things that you need to make the patient understand. Give opportunity for them to ask questions. Give time for them to answer the questions. There must be a consent signed before the heparin drip is usually started, except in a very emergency state where it has to do with life and death, or there is no family member around. So if they are going to procedure, let them sign, put this thing. These things has to be stopped, and before they can ever do any kind of surgery. Thank you.